Now, let's welcome Heather Garavelli, the manager of rehab services with Novant Health Rehabilitation Center here in Shallotte. Thank you so much for coming today, Heather.
Thank you for having me, June.
Yeah, we've got some exciting news to talk
do.
about in a little bit. But first, tell me a little bit about outpatient rehab services. Just give me an overview. What kind of services does that entail?
Yeah, so our rehab center has physical therapy, occupational therapy, and speech therapy. So we cover the whole gamut of rehab.
Awesome. So our viewers will understand and give me a little better understanding. Tell me a difference between physical therapy and occupational therapy.
That's a good question. So physical therapy is more gross motor. We always say that they'll get you from point A to point B, and then occupational therapy is going to help you when you get there. So they're more coordination, yes, like dressing, bathing. So we'll help you get out of the bed and get to your dresser, but they're going to help with, pulling out your clothes, dressing, bathing.
Putting socks on?
Yep, putting socks on, all of those good things. And then there are a lot more shoulder, wrist, elbow, hand.
Yeah.
So, yes.
Oh, wow. Tell me some of the reasons people will need physical therapy.
For anything. Pain, post-op after you have a surgery, vestibular issues, vertigo.
Vertigo.
Yep, incontinence, pelvic pain. A little bit of everything. Balance, any neurological, disorder. If you've had a stroke, Parkinson's. We have Parkinson's certifications for PT, OT, and speech. So we have a big program for that.
Wow, that's awesome. So if somebody needs to come to physical therapy, do they need a provider referral?
So in North Carolina, it's actually direct access. So you can go
it is?
straight to, yes. But we always recommend getting a referral regardless, just so your provider knows what's going on. It's better communication, and then insurance will definitely cover it too. So it's just a safe spot. Yeah, I definitely recommend it.
So I know that folks come to physical therapy maybe 2 or 3 days a week.
Yes.
So what happens when they go home? Should they continue that on their own
Absolutely.
In between visits?
Yes. So we will give you exercises. We want to make sure it fits into your lifestyle. So if you're coming to physical therapy, OT, speech, and it's just too much or you don't know why you're doing something, definitely ask, because the more you do at home, the quicker you're going to get better. You're only with us, if it's 2 days a week, you're with us an hour and a half. So there's a lot of time spent outside of rehab. So, there's a lot of time to be working on things to get better.
Right. I know that it varies, the length of time that you're in therapy, it varies with the person or the condition. But is there, do you start with a 6-week program or 12 weeks? Or
what we tend to do is start with 4 weeks. I think a lot of the patients will end up being 2 times a week, which is standard, but they can do 1 or 3 times. Some of our Parkinson's patients do 4 times a week. And then we'll go through the 4 weeks, we'll kind of reassess, see where you're at, and we can extend it out. I'd say usually around 12 weeks will be the max. But some people are better over, a couple visits, or they feel comfortable doing it at home, and they get better that way. So.
Right. Well, I know it depends on your plan, your insurance plans, and things like that, but most health insurances cover physical therapy.
Absolutely, yes, they do.
Yeah, especially after a surgery or something like that. Yeah. So let's get to the fun stuff. You have a new space.
We do.
And I want to know all about it.
So
you have so much more room.
I know, it's huge.
Well,
it's
first
beautiful.
Tell us where it is.
Okay, it's at 512 Village Road in Shallotte. So that is down by Novant Health Oceanside.
Family medicine.
Yes, family medicine. And the Food Lion kind of over there. It's a large 2 gym areas, huge treatment rooms. We have some new equipment so that we can, help everybody with everything a little bit better. Very exciting. It's very beautiful, which always makes it more fun. So.
Yeah. So tell me how much space you have.
I do not know the exact square footage.
But
I'm sorry.
You have 2. That's okay. That's too far in the weeds.
Right. Yeah.
But you have many more treatment areas.
Yes.
Is that right?
Yes.
And do you have private treatment rooms?
We do have private treatment rooms. So any patient that needs, private space or to do your evaluation so that you're comfortable, speaking about everything, yes. There is a lot of private space, and then we have the open gym area too.
Tell me about the furniture. Is it beautiful?
It is gorgeous, yes. And it's new and beautiful. The colors are beautiful. It's very bright and airy.
Yeah. You touched on equipment. Have you added new equipment?
We have new weight equipment, some things for balance, a little bit of everything. So, yeah.
Wow.
Yes.
It's
been a long time coming. We're excited.
Tell me how do you think the patients will benefit more from this new space?
New equipment, I think it's just a cheerier place even to, come in and get your treatment. And I also think that being with Oceanside and Neuro and having all the providers right there, it's just better care for everyone.
There'll be a lot of specialists in that building,
absolutely,
right?
and we can all communicate with each other and make sure that our patients are having the best quality of care.
And there'll be primary care in that new building,
Yep.
as well as in Dr. Eisenhower's office.
Yes,
That's
right there.
And the convenient care.
Absolutely.
So what are your hours?
We are 7:15 to 5 o'clock.
And is that 5 days a week?
Yes.
7:15 to 5.
Yep.
And again, you don't really need a referral, but it's a great idea to have
I would
one.
recommend a referral, yes.
Yeah. Well, Heather, it's been such a pleasure to have you here, and I'm so excited about the new space. So is there anything you'd like to say to our viewers before we close?
Yeah, I would just say if you're having any pain, struggling with, doing something that you used to be able to do well, or balance issues, anything that you can think of, definitely go to your doctor and talk to them about it, and we'd love to see you and help you out at our clinic. So.
At your new space.
Yes, at our new space at 512 Village.
Thank you so much, Heather. Please
Thank you,
come
Jen.
back.
I will, thank you.
Okay.